Hi, my name is JuleAnn Lieberman, and I'm a certified low vision therapist and an assistive technology professional who is employed right now at Pennsylvania Initiative on Assistive Technology, a program at the Institute on Disabilities at Temple University. I also am a person who has profound vision loss. I have best refracted correction, OD, my right eye, of 20/1600, and OS, my left eye, of 20/800, and OU, together, I see 20/600. I was diagnosed in 1969 at the age of 12 by a retinal specialist in Philadelphia with Stargardt's macular dystrophy, and later reclassified as cone rod dystrophy. And I wanted to first speak to you about a couple of issues that I would want my healthcare professionals to know about persons with vision loss. First off, the diagnosis. When you're working with someone who's been diagnosed with a progressive vision loss, be upfront. Tell them that it is a permanent condition. You may not know how far the progression will occur and when, and that's fair to tell them. But one thing that's very important for you to know as that person leaves that chair, regardless of the age, is that there are alternatives there for them to lead a productive life with support services, including rehabilitation, training, and optical devices. At the time I was diagnosed, I was told you have a permanent condition, you may end up going totally blind, and that's all I can do for you. And it would have made a big difference for me had I known what was available for me out there as far as rehabilitation, optical devices. I say it would have saved me a lot more energy when I was trying to do my schoolwork, reading my books 2 inches away from my nose, spending a lot more time where I could have spent out with my friends having fun, working harder on my schoolwork. I don't hold sour grapes about this. I just want professionals to know if you are giving someone a permanent diagnosis such as that, find out what other resources are out there and refer them on to extra services. As I progress now into my adulthood, I've had both positive and negative experiences in the medical community at large. The most positive experiences occur when people recognize that they can provide the help that I need. And it is not that much of an inconvenience. It may be different, but it may be an inconvenience for them, the way they view things. For example, when I go into a doctor's office, typically I might have someone with me, but very often I don't. So if I'm given by the receptionist at the front desk a form to complete, it is kind of pointless because I can't see the print. A good response was one I just had recently at a medical clinic where they said, no problem, we'll have the nurse practitioner help you fill this out. A bad experience is when the receptionist will say to you, well, why didn't you bring someone along to help you fill out the form? And yes, that has happened to me. And they very frustratingly say, well, I don't know what we can do. We'll have to ask the doctor how to do this. So keep that in mind, that you may have to spend a little extra time, either as the physician or as another person in your staff, reading the questions and completing the paper form. That's one of the frustrating moments. The positive moments are when someone recognizes the fact that I am a person and that they don't talk to my significant other about my medical conditions, they talk to me. When I was diagnosed as an adolescent, it was very often they were talking about me outside the room, and my hearing is very good. And that was very frustrating because I felt more like a diagnosis rather than a patient. So keep that in mind. This is a person who's being diagnosed with a vision loss. Another helpful thing to recognize is that persons with vision loss can have varying levels of vision. And the best tip I can give anyone in the medical profession is, one, ask, how can you be of service? Thank you for your attention and have a great day.